Hi, I'm Dr. Ahadian. I am discussing a response to a question that was sent to me regarding the ADHD, and the question was basically the episode that we were discussing about attention deficit disorder with the behavioral problems and the parental control and the parents dealing with the attention deficit disorder child. And the question was basically that are you saying that it's parents' fault that the children are acting out with regard to the attention deficit disorder syndrome? The issue that I wanted to discuss today is that basically the opinion that I have with regard to the attention deficit disorder and basically most of the disorders in the psychiatric levels is basically based on a genetic and biological mostly and environmental and psychosocial aspects. Now basically the attention deficit disorder hyperactivity is a genetically based biological disorder based on certain changes in the circuitry and the chemistry of the brain. And therefore, if you have a child who's suffering from attention deficit disorder, the question goes back to whether and where is this genetic precondition coming from. And the parents are the source of children, basically, giving birth to children. And therefore, if you have an attention deficit disorder child, if you go back in the history and background of the family and the parental background, you would see, and one would basically see the ADD precondition in the parents. And therefore, there is a question to discuss that the parents who are having this disorder, this problem, this syndrome, have issues with regard to their own self-control, and then they have irritability, not being able to set appropriate limits due to their poor concentration, poor ability to be patient, and therefore this becomes a psychosocial, is a social, and the environment basically then comes to play, which is that when the parents have this kind of problem, then they cannot really deal behaviorally appropriately with the children. So the answer to that question is basically it's not the parents' fault, it's nobody's fault. It's a genetic precondition so that in the family history we have all these problems continuously exhibiting itself. So the better way to understand this therefore is to see the genetic precondition, the way it's transferred through generation. And if you see a kid who has attention deficit disorder with hyperactivity, it's not coming just by itself. It is a linkage to the parental ancestry and to the family and the genetic genome of that child. So it has to be looked upon very broadly to be able to be treated. I hope I had answered the question, and hopefully if there's any other questions, my email is ahadians@aol.com, and you can respond to the blog at YouTube. Thank you.